Okay, start please, Dr.
Hello, I'm Dr. Amairi, the doctor in the clinic today. Are you Miss Glenda, 40 years old?
Yes, doctor, correct.
We are here to discuss some issue related to your health and to examine you. Is it all right with you?
Sure, doctor.
Miss Glenda, I will take some notes during our meeting. It would be totally confidential, okay?
That's fine.
Okay. What's brought you here today?
Yes, doctor, I have got a problem with my heart, doctor. Sometimes I do get really fast heart rate. Sometimes it's like coming and going. I don't know what's wrong with me, doctor. So I'm really worried about having problem with my heart.
Okay, this has started since what?
For 3 months, doctor.
Okay, and since 3 months, is it first time you noticed that?
Yes, it's the first time. Before these 3 months, I do not remember having such episodes.
Okay. It's permanent or comes and go with attacks?
It is always there, doctor. Although sometimes I feel that there is an episodes where my heart is not beating regularly, doctor.
Okay.
Yeah.
Anything you noticed make it better, like rest?
Not really, doctor.
Anything make it worse, like exercise, like stress?
No, doctor. Not really.
Since that time you noticed, is it increase, decrease, or the same?
I feel it's getting worse, doctor.
Okay, I'm so sorry for that. I will try to help you as much as I can. So, Miss Glenda, do you have any medical condition should I aware of?
Not to my knowledge, doctor. Not that I am aware of.
Any surgery before or any admission?
No.
Okay. Do you have an increase in your body temperature?
No, doctor.
Any lumps or bumps?
No.
Any weight change?
Yes, doctor. I have lost some weight.
Okay. Since what? Since how long and how many kilograms?
I guess for the past 4 months, and I lost around more than 8 kg, doctor.
Is it intentional or not?
What do you mean, doctor?
Is it intentional?
No, I did not manage to lose weight, doctor. My diet stays the same. I'm not doing any type of dieting, and also the level of exercise is also the same.
Okay. And what's your about your appetite? Is it okay?
I feel
Is
like
increase?
I have a good appetite, doctor. I'm eating well.
Okay. Any lumps or bumps? You notice like some swelling in
No,
your
doctor.
neck or any neck
No,
swelling?
no at all. Yes, I have got some swelling, doctor, in my leg, as you can see.
Okay. Did anyone tell you that you are paler than before?
No,
Okay. Any hand shaking?
no, doctor. Just when I feel hungry, sometimes I do get the shakings.
Okay. Any feeling hot?
Yes, doctor. I have noticed that I am always hot, no matter how the weather is cold. I always feel it. I feel hot, doctor.
Okay. Any change in your bowel habit?
No, doctor.
Any chest pain?
Occasionally, doctor, I get some loose motions and sometimes also bleeding.
Okay. Any chest pain?
No, doctor.
Any shortness of breath?
No, not really.
Any cough or coughing of blood?
No,
Any lower limb swelling?
no, doctor.
Any tummy pain?
No. Just
Any
sometimes
change in?
discomfort, as I mentioned, and I'm bleeding.
Okay. Uh, any high blood pressure?
No, doctor.
Did you notice have any history of high blood sugar or low blood sugar?
No, doctor, no at all.
You tell me that you have handshaking when you are hunger. Any hunger pain?
No,
Any history of blackout?
no,
Any dizziness from standing position?
no, doctor, at all.
Okay. Any change in your water work amount, color, or frequency?
No, I feel my water work is fine, doctor.
Any abnormal sensation in your hands and your feet?
No,
Any headache?
no headaches, doctor.
Any joint pain?
No, doctor.
Any skin rash?
No skin rash, doctor.
Okay. Any skin change like tanning skin or loss of the or hypopigmentation?
No, doctor.
Okay. Any change with your vision? Any problem with your vision?
Sometimes I do get blurred vision, doctor.
Okay. And since what that you have?
I'm not sure really, doctor, but it is maybe for 1 month, doctor.
Okay. Any muscle weakness?
Muscle what?
Muscle weakness, like if you
No,
find difficulty when you combing
no,
hair or going
no, doctor.
upstairs.
No.
Okay. And what about your, I'm so sorry to ask you some special question, private question. Can I?
Sure, doctor.
What about your period? Is it regular or irregular?
It is scanty, doctor.
Okay. Are you married?
Yes, doctor.
I'm so sorry to ask, do you have any extramarital relationship?
No, no, at all, doctor. I'm monogamous to my husband.
Okay. Any birth control pills?
No, no.
Any chance now to be pregnant? Hello?
I don't think I am pregnant, doctor.
Okay. Uh, do you have any history of sharing needles, tattoo,
No, I do
piercing?
not share. No, doctor. I do not
Okay.
share any needles, yeah.
Can you show me your medication list?
I'm not taking any.
Okay. Do you have any allergy?
No, not that I know.
Okay. Do you have any family history of gland disease?
I am adopted, doctor. I don't know. I don't know my family.
Okay. Do you know anything about your family?
You mean my biological parents?
Yes.
No, doctor. I just have got some photos, but I didn't get to know them.
Oh, so Miss Glenda, what have you ever smoked?
Yes, I do smoke, doctor.
How many cigarettes per day? For how long?
Around 10 cigarettes per day, doctor.
Okay, I advise you to stop smoking as it's harmful to your general health and to your condition. And if you are happy for that, I can refer you to a smoking cessation center.
Okay, thank you, doctor. I think that would be helpful.
Okay. And do you drink alcohol?
Just occasionally, doctor, and especially over the weekend.
Okay. And what do you do for a living?
I am a housewife.
Okay. How this affect your daily activities?
Yeah, really, doctor, because the heart racing, doctor, I am really worried that I could have a problem with my heart. And also, my friends are commenting that my eyes are changing in shape. So this really makes me worried, especially that I lost also some weight. I don't know whether I have got a cancer, doctor, or problem with my heart. Could you please explain to me what's wrong with me?
I highly appreciate your concern. I will try my best to answer that after examining you. Can I?
Sure, doctor.
Okay.
So what
First
you
of
want to
all,
do?
if you need any help at your home, I can refer you to a social workers. Okay.
Okay, doctor, thank you.
Okay. So first of all, I would like to do vitals, especially pulse, regular, irregular.
So vitals
This
are
is
mentioned outside, and
yes,
heartbeat is
same.
regular, yes. Irregular.
Okay.
It's the same reasons
Irregular,
also. Yes,
irregular.
irregular.
Okay.
Irregularly irregular. Mhm.
Okay. Blood pressure, same as mentioned.
Yes.
Okay. Can I examine your heart? I will examine the heart. Any murmur?
Negative.
Okay. I will examine, please, your eye. Can you follow your? Can you fix your head and follow your eye with my, follow my finger? Okay. The H shape.
Okay.
Please, if you
She has
have
got
pain and if see double, please tell me.
excellent. Excellent. So she has got some, she can move her eyes in all directions, but she has got some double vision, especially on the transverse vision.
Okay. Do you have a dryness like pins and needles in your eye?
Not really. Sometimes I do get dryness, but no pins and needles.
Okay. I will check visual acuity.
Okay, it
Do
is
you?
normal.
Okay. Can I examine your neck, please?
This is my leg, doctor.
Okay. Please, I need to water. When I told you to swallow, please swallow. Okay.
Yes, there is minimal diffused goiter, which moves with the swallowing.
Okay. I will do a percussion for this. Is it radiated to sterna or
No,
not?
no retrosternal extension.
Okay. Do you have any difficulty with swallowing?
No, doctor.
Any change in your voice?
No, doctor.
Any shortness of breath?
No.
Okay, I will offer to examine the lymph node around that, and I will do auscultation. Any pruit on the goiter?
No, Brui, and you have asked also for auscultation or lymph nodes, yeah, and it is negative.
Yes.
Lymph nodes
Okay.
are negative. Yeah.
Okay, I will do lower limb examination, looking for any swelling
Negative.
or any erythema.
Negative. Just like
Okay.
in the picture, there is no significant swelling, but as you can see in the picture is positive to screen.
Yes. Okay. I will offer to examine the abdomen, any masses.
2 minutes remaining. No need. Skip, please.
Okay. So, Ms. Glenda, after examining you and taking history, I'm thinking about a condition we called Graves disease. Have you ever heard about that?
No, doctor.
Okay, it's a medical condition which there is a problem in your defense system that mistakenly attacks your gland. So it becomes to over growth and overproduction of some important protein we called thyroxine, so that you have these symptoms. Okay.
Okay, doctor.
Just I want to ask you some question. This is vision problem is sudden now or before or gradually? Do you have any change, acute,
It is.
sudden
It is.
change?
It is very minimal, doctor. Just sometimes I feel that my vision is hazy. Okay.
Yes.
Yeah, but it is not very significant.
Okay. So I will do some blood test and some investigation, some scanning to your neck, and I prefer to do admission. Maybe we need to give you medication through your blood channel to protect your eye and to protect your vision. And I will do some blood tests and some scanning to your neck to confirm our diagnosis.
What kind of medication through the blood channel you are going to give me?
What?
What kind of medications you are going to give me through the blood channel?
We called steroids to protect
Okay.
your eye. Okay?
Okay, that's
And
fine.
I want to ask you, do you drive?
Yes, I do.
Just I advise you to stop driving until we assess you because you have a vision problem. Does it make sense for you?
Yes, doctor. Sure.
Okay.
We'll do that.
Do you have any other concern?
No, doctor. I guess you answered all my concerns. Thank you.
Okay. I will give you also some drops to your
Wait,
eyes.
I'm up.
Okay.
Excellent. I will count this. Also, I have put a cross over eye drops, but you saved yourself at last.
Yes.
Okay. So, doctor, please, could you summarize your history to me and what are the positive data from your case
Okay.
today?
This is Ms. Glenda, 40 years old, came with history of palpitation since 3 months with some weight loss with good appetite. She has a feature of hyperthyroidism, such as palpitation, weight loss, some loose motion. She has features of neck swelling with no compression symptoms. She has also a double vision with Graves ophthalmo. Graves
Ophthalmopathy.
disease. Yes, ophthalmopathy. Yes.
Okay.
So my differential diagnosis: this patient has hyperthyroidism. For differential diagnosis, first of all, Graves, because she has a diffuse goiter,
Okay.
smooth goiter. Other differential diagnoses could be thyrotoxicosis due to thyroid nodule, but I couldn't appreciate any nodule or any nodular
Do you think
goiter.
multinodular goiter and thyrotoxicosis other than Gravis can result in thyroid eye disease?
No, that's against
Okay.
that.
Okay, excellent. So, what are the findings you were able to detect in your examination today? You mentioned of orbitopathy, and you mentioned also the tachycardia, I guess. What are the findings
Yes.
you were able to detect today?
I examine, this is the rash, the erythema in his limb, but I forget what the name of this sign.
Pretibial myxedema.
Tibial
Okay, anything
myxedema.
else?
What else? Yes, she has ophthalmopathy during Graves. She has
Okay, so how are you?
ophthalm.
Okay. So how are you going to investigate this patient?
I will do admission first of all. I will do basic inflammatory CBC, inflammatory markers, RFT, LFT, TFT, auto antibodies, especially anti-TSH. I will do goiter, thyroid ultrasound and the thyroid scanning. I expect to find the high uptake.
What is the justification for her admission? Are you going
Just
to admit the patient or refer her to ophthalmology?
I think admit the patient and during the admission refer to gland doctor and to ophthalmic.
Okay, that's fine.
Just to see,
Okay, what else?
to do, yes, MRI for the eye to see any compression of the optic nerve to manage urgently. What else? I will give non-pharmacological treatment, education and counseling this patient about the disease, advice to stop driving, stop smoking, and advice to take artificial tears and to wear glasses. Medication to control the symptoms. I will give her propranolol to control the symptoms, ECG and echocardiography, because she has the atrial fibrillation, and this is positive finding. What else? ECG. Okay, for treatment of the Graves disease regarding thyroid, because she is not pregnant and not child pregnancy, I can start carbimazole for that.
Okay.
For Graves
so,
ophthalmopathy.
Are you aware of any surgical treatment for Gravis ophthalmopathy?
Can you repeat the question?
Are you aware of any surgical options of treatment for Gravis ophthalmopathy?
Yes, decompression.
Okay. Anything else? Tarsophy, right? Tarsophy. So you mentioned that you're going to start carbimazole for this patient. Let us assume
Yes.
that you started carbimazole, but the treatment was not successful. What are the options you'd like to try?
Propylthiouracil, we can give her.
It was not successful. What are
Thyroid
other options apart from medical treatment? I mean, medications.
PTU and carbimazole. This is only iodine not over here because she has ophthalmopathy.
Excellent. Okay, what else? What else you can try?
Thyroidectomy. This is
Excellent.
surgical,
Excellent.
not medical.
Okay, well done, doctor. So please move to the next session. Okay, well done, Dr. Ala. You did really nice. You know, you would have scored the full mark if you just requested fundus examination. This is
Yes,
the only
I
missing
wrote it,
part in
but
your.
I forget.
This
Yes.
is the only missing part in your case, and it's important because it will affect skill A, which is physical examination, because this patient had blurred vision, which is very dangerous in a patient with Gravis ophthalmopathy.
Looking
Because
for papilloedema or something.
optic atrophy, papilledema,
Yes.
okay, you need to examine the fundus, okay? And if the patient had features of vision affection and he has Gravis ophthalmopathy, this is indication for urgent referral to the ophthalmology. So if you do not request fundus, it will affect skill A because it's a step in the examination. And it might affect skill B if there is findings. For example, this patient has got optic atrophy, you will lose some score out of skill B. And then you did suggest referral to ophthalmology, so I don't think it is going to affect your skill E, which is the clinical judgment. Okay, so they might take around 3 marks only because of the fundus, because they will take from skill A, let us assume 1 mark, and skill B, if there is any finding, again, it will be affected. Okay, but however, in general, you have done great. You covered everything. Just whenever you have got a vision complaint, never forget to cover the eye examination, full eye examination. Okay. Regarding patient welfare, was no issues with patient welfare because she did not cause any emotional discomfort to the patient. When she asked about the period, she did take permission before asking this question. So I would like to ask you a private question if you allow me. Yes, doctor, and then ask about period. Same is applied for illicit drugs. Okay. And then during examination also, before touching the patient, try to ask about pain, especially if you are going to do deep palpation for the tummy, for example, or examining joint. It's very important to ask about pain and try to be gentle as possible as you can. Okay. Because if you cause any physical or emotional discomfort to the patient, this is going to affect your patient welfare. And by the way, patient welfare, more than 80% of candidates will get the full mark within patient welfare. But again, it is very dangerous because the pass window is very narrow. You are allowed to do it twice within the exam and you are done. Okay, you can fail the exam. So this was a very straightforward case and very common case, by the way, and appeared just day 3 in Kenya centers. Okay, Nairobi center. Okay, so because it is common and easy and straightforward, the examiner is not going to allow any mistake. Let us assume that you are facing a very rare case in the exam, like Takayasu arthritis, for example. They will allow you for some mistakes because it is not as common as Gravis disease. Okay, so it is not about the diagnosis, by the way, because whenever you enter the station, by just looking into your patient, you know that this patient has got Gravis. And since the complaint from outside is tachycardia, he is in thyrotoxic state, possibly with atrial fibrillation. okay, just by general inspection and by the complaint from outside. But in basis, when you apply for a specialty level exam, it is never about the diagnosis. They will need you to search for complications. They will need you to search for associations. Okay, and also they expect you to put a full plan of management covering everything. Okay, so let us assume that I would like to cover this case from outside, just from outside. By the way, there is findings you can mention to the examiner. What kind of findings are mentioned in the scenario from outside? Any idea? I will post the scenario again. Just a minute.
Tachycardia.
Exactly,
Tachycardia.
tachycardia. What
Maybe
else?
due to anemia.
Or thyrotoxicosis, right? Thyrotoxicosis per
Yes.
se can result
Yes.
in tachycardia. So whether this is sinus